up, or excising some skin and tissue. And that could be arms, thighs, it could be chest work as well, gynecomastia, and then for tummy tucks as well.
Awesome. So what does post-op look like? What to expect after for recovery, I guess?
Yeah, so men are babies, right? Like, we don't do well with pain at
As long
all.
as you can admit it.
That's half the battle, right? And so, I mean, women go through childbirth in this part of it. So in terms of the actual surgery for men, since we're not doing a lot of work on muscles, the recovery is actually pretty easy. It's mainly skin surgery. They're removing the extra skin and then redraping everything where it should be. Now, the hardest part for men is like keeping them down, right? Following directions, making sure they have the right adequate protein and nutrition so they heal the right way to get the right results. So in terms of recovery, it can be anywhere from 2 weeks or less, depending on what type of surgeries that you have done, since it's all skin related and not muscle related. Now, does that mean that you're back in the gym in 2 weeks? No, it doesn't mean you're back in the gym in 2 weeks, right? You need everything to heal to the strength that you need it to be. And that's usually at 6 weeks of where we let the resume to regular workouts, and that part of it, we're not limited to 10 pounds of heavy lifting.
Right. All right. So as far as, I guess, areas that you can do, you said chest, arms, thighs, any other types of treatments that would pair well with those, or other things that would be common, I guess?
Yeah, I mean, also with the weight loss, also anything with the face, right? So you have weight loss with the face, extra skin, you're replacing volume, doing more of a facelift, neck lift, redraping everything to rejuvenate all that. Because now it's like you want all the outside to match up to the inside. They're super strong on the inside because they've lost the weight, they've gained muscle, they've done all the right things there. Now to get to that point, now it's just about redraping all the different things, contouring all that tissue. And that comes down to diet, nutrition, and then also the extra skin of just removing those areas, right? It could be the bat wings and stuff like that. And especially it's like men try to be superheroes, but that's not something that's superhero-like in terms of having that extra skin that hangs down.
Yeah, definitely. So after weight loss, do we have to wait a certain amount of time before we're going to remove the skin? Or I guess what amount of weight loss would make somebody a good candidate for this type of surgery?
Yeah, that's an awesome question, right? And so I think the biggest thing is as soon as the weight comes off, everyone's going to run in and come do it, right? But they're still losing weight. So you don't want to have a transformation mid-transition in terms of your weight. You want to make sure you do it after you get to close to your goal weight, like 10 to 15 pounds of your goal weight, and you want to have at least 6 months of stable weight. And which stable weight means like within 5 pounds, where you're not fluctuating too much, because you don't want it to stretch out after we do all this surgery, you go through the recovery, and then it's not the exact result that you want.
So within 5 pounds or so of that goal weight.
Mm-hmm. Yep, I think that's a clear answer in terms of within 5 pounds of that goal weight. Make sure that you're stable for a period of time, that you can maintain it, and this is kind of the new lifestyle, the new norm.
Okay, awesome. Do we have any questions?
You know we do. So Blake wanted to know, what is the recovery time like for gynecomastia surgery?
So gynecomastia, for that surgery, usually we're having to place a drain in. That drain will stay in for about a week or so. Recovery is usually done at about 2 weeks in terms of being able to resume all the normal things you would do in life, but no workouts, no heavy lifting to pop any of the sutures or any of that stuff until 6 weeks.
All right, we have another question. How does male liposuction differ from female liposuction?
It's super different because you want different contour lines, right? And so the high definition ab etching and this and that, you're going to etch out all the muscles a little bit differently, because if you look at a female tummy versus a male tummy, they just look different. And there's different things that people find attractive, whether it's the curvature, how the sides are brought in, whether any of those side muscles are etched out or not. And so there's all these little different techniques in terms of where we want to show that we have muscle and where we don't.
Awesome. Another question that we have is, what are the most common procedures that men are asking for right now?
Yeah, so I think right now the biggest ones are the lateral chest lift, the tummy tuck ones, and especially bringing up any of that lower extra hanging skin that can be embarrassing for a man to talk about or even like come in for. Like those are the things that are probably on the rise, because of the dramatic weight loss, right? When you have that much extra skin in those areas, there's nothing else that we can really do about it with any type of medication or any type of clothing, right, to hide all the stuff for certain areas. And I think those are things, it's like an emotional and psychological connection to those things to say, hey, is this the best version of that I see in the mirror? Like, I've been busting my butt, I've been working out, I've been eating right, doing all these things. What else, can help me at least feel the way that I do on the inside in terms of what I see in the mirror?
Awesome. We have a question. It is, are there any trends in male plastic surgery that have surprised you?
Yeah, I think that one of the bigger trends of a lot more men are now open to doing facelifts and neck lifts. And I think that was a trend that I probably didn't see coming, but it makes sense with this weight loss that people are seeing themselves age at a faster rate when they're doing this rapid weight loss. And I think that's one of the biggest things that I've noticed to say, hey, it's kind of surprising, but it makes sense to say how much of a drastic change it is and what's acceptable. I think a lot of things in society are changing as well. I think the dual income dynamic of women also is on the rise. So I think beauty for men has also risen in terms of importance. And it's not just about status and monetary value anymore in households. And I think that's also changed the dynamics of what men are now willing to do.
Awesome. Ryan was asking, how do you make sure the results look natural and not overdone?
That's a great question, especially for men. The worst thing you can do for a man is make the result look like a female, right? And so that's the thing of making sure that we're super cautious in terms of where we hide the incisions. And in terms of plastic surgery, the secret is that we hide all the incisions in the shadows. And so if we can create the shadows where we have muscle lines, like pec lines or things like that, then it makes it natural, not overdone, and people don't really even notice that you had anything done.
Awesome. Blake was asking, have you ever had a husband and wife come in for procedures at the same time?
Yeah, that's a great question. I mean, a lot of these weight loss journeys are done as families, right? It's a group, it's a team. They're doing all this part together, and they do want to have their surgery done at the same time. One of the things to be cautious about is that who's going to be there to help, right? In terms of that, if they have a good family support system and their kids are old enough to take care of them, or they go to a recovery center, then I think that's an acceptable thing. Now, if they don't, and they're just by themselves, then I recommend staging one person at a time to make sure that they've recovered and healed, and then they can do their part for their partner.
Awesome, great advice. Carlos was asking, this might be a question for you, Meredith. Is Botox or Botox for men more common now?
Yeah, definitely. I see a lot of male Botox patients. It typically requires a lot more units, as you know. They have a lot stronger muscles. Yeah, a lot stronger muscles. So yeah, definitely becoming a lot more popular now.
Awesome, great, thank you. Ryan was also asking, what would your advice be for a man who's wanting plastic surgery but is a little nervous?
Yeah, I think that do your research in terms of saying, hey, what exactly do you want to change? Why do you want to change it? And where does that make actual sense to have these changes be done? And I think doing the due diligence in terms of finding a board certified plastic surgeon, having an open conversations in terms of what are my expectations of what do I want to look like? What do I have? And is this a possibility? And what is it going to take to get me there? Having those questions answered is, I think, the key to saying you come up with a game plan together with the doctor that you've chosen. And I think that's what gets you your best result.
Awesome. What's the most popular age group for male patients?
Yeah, I think any male patients right now, it seems like 35 and older are optimally looking for these types of changes. And there's different things that different age groups are seeking, from 35 and older to 55 and older to 70 and older. It just all across the board, there's different areas of importance. And I think it just comes down to what matters to you. I don't think it's an age that defines when you have it done. It's more so, what does it make you feel like?
Awesome, great advice. Somebody was asking, are there different types of anesthesia or pain management for men versus women?
Yeah, so I think pain management, I think we can agree that men are babies. And so therefore in pain management, like we treat both men and women the same in terms of being able to do blocks on them. And this is to block out any of the local areas that we treat. And so with liposuction, we're already putting a bunch of lidocaine in those areas. And so that's actually gonna heal pretty well, and it's gonna be fairly pain-free. It's just gonna be sore in terms of that part. The other part blocks that we do along the chest and that wall, it's just a intercostal block or a specific muscle block that we're doing to make sure that you're having a good recovery. A lot of times our patients feel better than they should. And that's something that with men, we want to make sure that we don't overdo it, because we can have a tendency to bleed, especially with testosterone levels and that part of it. There's definitely an increased chance for bleeding for men overall.
Thank you. And then we had one more question. It was, what's a procedure that you think more men should consider but rarely do?
Yeah, I think that's a great question. I think tummy tucks are something that men don't think apply to them, right? They just like, oh, well, women get tummy tucks because they have kids, because their muscles are separated, this and that. I think men don't realize like a tummy tuck includes the tissue from the stomach, but then also a tissue from the pubic area that also can overhang or be in the way or cause irritation, rashes, all these other things you don't really have to deal with. You don't have to live that way, and you can make it still look natural without feminizing that area. And so I think that's probably the biggest thing in terms of an area that gets undertreated, and people don't think that they're a good candidate or it's going to change something about how they might see themselves. And I think that's the biggest thing for that.
Awesome. Well, I think that wraps up all of our questions that we had. So do you have any final thoughts or something?
Yeah, I think the final takeaways essentially is that men can have plastic surgery too, right? You don't have to sit on the sideline. I think, the thing that I alluded to, how the dynamics between men and women have changed in terms of femininity and masculinity, what women are looking for, what men are looking for. I think beauty is now in both categories. It's not something that is something like to say, okay, well, I make this amount of money and that's what's that women are gonna find attractive. I think nowadays, like, women have their own earning potential. They're interested in a lot more than just the financial means of things. And I think that's where the society has changed and shifted quite a bit in terms of what we as a culture now accept in terms of plastic surgery. And in terms of men that are doing the work and just need a little something to get across the line, especially for the weight loss patients, or anything else as we age, to just feel younger or feel more alive in what we're doing. I think if it bothers you, you do it.
It's about that confidence. And not only that, like you were saying, as well as, hygiene reasons, things like that, as far as the tummy tuck and just having that excess skin in the way as well. So yeah, I agree for both men and women now.
Absolutely.
Awesome.
All right. Thanks for tuning in.